Hi, Dr. Boris. I want to talk about nose jobs or rhinoplasty because that is really a specialty on its own that I've really mastered. I've been doing it for close to 50 years. And because I've done it for so long, I've seen the evolution and the technology grow. We first started out doing closed rhinoplasty, and now we've evolved into open rhinoplasty. And the open rhinoplasty is where you're actually cutting the skin and lifting it off. You're just taking the skin and elevating it up to the root of the nose so you have access and good visibility of the structures of the nose, so you can, in some cases, it's felt you have better access and better exposure. I like doing closed rhinoplasty because I really, in almost all cases, I get great exposure and can do everything without making the cuts on the outside. I don't like cuts on the outside of anything. That's why I kind of developed the trans-umbilical breast surgery, but same thing with the nose. I mean, I can do in almost 95% of patients everything I need to do to make get a perfect result. And my philosophy is to make it look non-surgical and natural. And with an incision under the columella, it takes away from that, and in my opinion makes it not cosmetic, as more of a reconstructive procedure. And indeed, if I have a patient who has a saddle deformity or a deformity of the nose that's really bad, and I need to take rib cartilage or ear cartilage and do a big reconstruction, then I would do an open rhinoplasty, but it's rare. In almost all cases I can do it. And doing it this way too is because I've been doing it for so long. I don't spend a lot of time, hesitating. So when patients wake up and post-op, they have very little to no black and blue or swelling or pain. And I don't pack noses. I stopped packing noses about 30 years ago. And the purpose of packing in most cases is to stop the bleeding, but my belief system is to stop the bleeding before you leave the operating room. And the packing just makes the tissues swell up with blood, and it can take weeks to recover. Without the packing, patients wake up and they look practically normal, and they have no pain, and they can breathe, and it's a lot healthier that way. So we do pretty much closed rhinoplasty. I get amazing results. It looks very natural. And again, I think you can't really learn nose jobs and rhinoplasty from a book. It takes, at least in my opinion, 20 years to really develop a sense and get the wisdom to do the procedure in the best way possible. And having 50 years doing it, I think I really am on top of my game. Thank you.